am Rika Miteres, and for today I'll be doing an intravenous therapy checklist, and in this checklist there are 3 parts. First is the starting of IV infusion, regulating and monitoring. Second is discontinue an IV infusion, and last is starting an infusion through volume control set or volumetric chamber. And now let's go into the procedure.
Place the IV card on the solution. Check the integrity or if there is an opening and the expiration date of the macro drip. Remove the cover of the spike because we will be inserting it on the hole of the solution, and make sure that we won't be touching the spike as it maintains the sterility. Make sure that the roller clamp is closed and secured. Next, we need a basin for priming. Squeeze the drip chamber and fill it halfway. We need to do the priming, to make sure that the air are coming out and it will be filled with IV solution. We don't need to remove the cover of the indent because we will be only removing it when we are going to insert it to the client. As you can see, I slowly push it up the roller clamp so that the IV solution will come out. After priming, close the clamp and remove the cover of the indent because we are going to insert it to the client. For regulating and monitoring, slowly open the roller clamp, set the timer, and count each of the drops per 15 seconds in the drip chamber. And I need to count 8 drops per 15 seconds.
I have already done verifying the client's identity, and now I am going to introduce myself. Hi, Miss Alexandra. I am Rika Miteres, your student nurse for today. And for today, I'll be discontinuing your intravenous infusion because you will be now discharging to the hospital as ordered by the physician. So I am going to discontinue now and I'll be removing those intravenous infusion to your arm. And don't worry because I have already performed hand hygiene and infection control procedures.
Before starting the discontinuation of IV infusion, make sure to wear gloves because we are going to touch the client. We need cotton balls with alcohol to remove the micropores sticking on the patient. Slowly remove the tape on the client, making sure she won't get hurt. Get a dry cotton ball to place it on a certain place that IV infusion is inserted. As you open the volumetric chamber, make sure to check the integrity and the expiration date. Remove any ties that bind up them together. Also, check the covers of the inlets and the spikes that they must be present. Put the roller clamp near or just below to the drip chamber and make sure the roller clamp is closed and secured. Next, open the solution. Carefully remove the cover of the spike, making sure you won't touch it to maintain sterility, and carefully insert it on the hole of the solution. For priming, slowly open the roller clamp and allow the solution to flow in the drip chamber for about 20 to 30 ml. After that, close the roller clamp. Before priming the line that goes to the patient, squeeze the drip chamber first and allow the solution to flow halfway in the drip chamber. Get the basin and open the roller clamp and allow the solution to flow into the line to push up the air. Do this procedure slowly and wait until some of the solution will come out on the inlet. Check if there is any bubbles, but as you can see as I check it, there is no bubbles that I found on the tube. Now it is ready to be connected to the client.